Modis, Gershenson,
Here.
Taylor,
Here.
Erickson Gall,
Here.
Nelson.
Here.
Cavell is present and will be here shortly. Joliet,
Here.
Lutz,
Here,
Davenport.
thank you. Please rise and join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. First item on our agenda is approving the minutes from June 5th, 2024. I have a motion by Commissioner Nelson and support from Commissioner Joliet. All in favor say aye.
Aye.
Opposed? Our minutes are approved. Next is approving our agenda today. I have a motion by Commissioner Nelson, support from Commissioner Joliet. All in favor say aye.
Aye.
Opposed? Our agenda is approved. We've arrived at our first public comment. The public comment is for items on our agenda. Is there anyone from the public wishing to comment today? Seeing none, our first public comment is closed. We move to communications. There are 6 items under communications. The first 2 are applications. One to the Michigan Department of Agriculture and Rural Development for the fiscal year 2025 Food Safety Training and Education Grant. The second application is to the Michigan State Housing Development Authority for the fiscal year 24-25 Housing Education Program. The third item is an amendment to the Comprehensive Housing Counseling Grant Program Agreement. The next item is from our animal intake and disposition report. And then next is Ageways fiscal year 2025 annual implementation plan. The last item are program reports using American Rescue Plan Act money for Healthy Food Access Initiative. Next is legal aid and assistance, and the last is the school mental health navigation program report for Q2. Are there any comments or questions on communications? Commissioner Gershenson?
Thank you. So I read an article that we have an abundance of animals in the animal shelter. And I'm just wondering if there's any plan in place.
Historically, Mr. Gatt will host an open house, but I have not heard of any additional planning for
So
them.
maybe we could ask for, an update, not at the next meeting, but just through email.
Sure.
And also a moment of personal privilege to congratulate Ms. Barbara Winter on her new position. We're proud of you. Thank you.
Yes, I am happy for you, but I still want you by my side. All right, do you want to prompt the vote for
We need a
I'll make a motion.
Oh, I have a motion by Commissioner Nelson, support from Commissioner Erickson Gall.
And then I just do voice vote on this one.
And all in favor of communication, say aye.
Aye.
Opposed? Communications are approved. Our first regular agenda item is a presentation from Hope 365, which is a peer respite and wellness center. So I would invite Deborah Monroe to present on this information. I have actually toured the house, understand the program very well. It's an amazing program, and I will let Deb tell you more about it. Thank you.
Thank you. I just want to say thank you for having me today. I just want to kind of introduce myself and our program here in Oakland County. It is something new that we brought to Michigan. There has never been a respite like this in Michigan. And so I don't think
I'm getting there for you.
Oh, okay. I'm not gonna go through a lot of the PowerPoint. There's just a couple of slides that I wanna share with you though. But just to give you a little background of like who we are and what we do is that, I used to work in a crisis setting, and, when people would come in for services, a lot of times I would ask them, how long have you been experiencing your symptoms? And they would say 3 or 4 weeks. And so, well, why didn't you come in earlier? Because I wasn't sick enough yet. You had to be in crisis to get help. And so there was never that in between. And so one of the things about 10 years ago, I started advocating for having a respite here in Michigan. It took until 2022 to be able to open it up. And over the last 2 years, we've served over 400 and some individuals that are struggling with their emotional wellness, maybe have a mental health diagnosis, and are able to get support. And we provide support through peer support and recovery coaches, because sometimes people are struggling with like co-occurring disorder or that mental illness. We help them look at their diagnoses in a different way, learn new coping skills to be able to manage those symptoms and still move on with their lives. A lot of things that we have experienced since we've opened is there's a lot of times individuals have needs, a lot of them. And so for the time that they're with us, we were able to look at what those needs are, help them, bridge some of the gaps in getting those needs met, connecting them to other resources in the community that they're not aware of, and things like that. We've also, like I said, as we provide that one-on-one support, we were funded through a grant through MDHHS, and that grant came through OCHN, which was Oakland Community Health Network. And they have been a huge support also of our program. Over that 2-year span of the grant, we were able to collect data. And I just wanna, so when we think about this peer respite, like I said, it is staffed all by peers, individuals with their own lived experiences with, like struggling with their own mental health or addiction that are now in recovery, certified by the state of Michigan and working as certified peers. I'm gonna skip through, a lot of times too is that, some of when we think about, not everybody needs or wants to go to a hospital setting. There's statistics that show that people actually get well faster in a home-like environment. So the facility that we have is a home. We are allowed to have up to 7 individuals. And a lot of times that we find is that the individuals that are coming in and there for the time that they're there, which is up to 7 days, actually support each other. And they build those bonds and connections. So how does someone come to us? And so, part of that is it has to be voluntary. We can get referrals from other organizations, but a lot of it's the individual has to voluntarily want to come because it's them taking personal responsibility for their own recovery. And so if a person is struggling in the community with stressors or symptoms, we get mothers that will call us and say, I'm really having a hard time. Right now I'm at home, I'm taking care of my kids, I'm taking care of my spouse, and I don't have any time to take care of myself, and I feel like if I don't do something, then I'm not gonna be well at all. And so they may come to us and just spend a few days and be able to regroup. We help pour into them and give them some of the things that they need to be able to take care of themselves, and then they go back home. We've had individuals, like I said, as different agencies in the community, like our core providers in the community here, will call us if they have someone that may not necessarily meet hospital criteria, but still need that added support. And so they're able to come to us and spend some time with us. And again, we give them that one-on-one time. And also we do 2 groups a day where we are helping them create a wellness plan for themselves that they're able to take with them. We do coaching over the phone. Once they leave us, they can come back for groups if they choose to. And then we also help them create a crisis plan. So if they did find themselves in crisis, what are the steps that they're going to take care of themselves, and who are they going to call? What resources do they have in that community, and things like that. We also get individuals coming from the crisis center if they don't meet that hospital criteria. We also get individuals that are coming from the CRU, like if they need more support but don't necessarily need that intensive inpatient service. They come to us that way. We are a step down from hospitalization. A person may still need extra support going back into the community. We help provide that support. And then again is the community, people in the community, once they hear about us or have been there already, will call us again and self-refer to come back into our program if they need that support. There's like 24 respites in the United States right now. We are on that map. We just need to get it on the map. And again, as like I said, 2 years ago was the first respite in Michigan. And there's data that shows that these programs work. right? And, not just for the individual, but also for the community and other resources that, sometimes like emergency rooms are all, full and they don't have beds available for individuals right away, and someone may spend a long period of time in a hospital setting. They can come to us. A lot of that process is a way, if they need more support when they call us, then we refer them to those other agencies. One of the things that we have been doing over the last couple of years is collecting data. And I think OCHN took about 176 individuals from the program that we did in the first year and a half. And they ran their names against the data that they have within their system. And it showed that 85 individuals saw a decrease in inpatient services coming to our program. They see 119 individuals saw a decrease in the CRU services, which is your crisis residential unit. 142 individuals saw a decrease in crisis contacts like law enforcement or emergency, and then 92 individuals saw a decrease in ER visits. And so we looked at this, and and the highest amount of reduction was the 80 to 100%. Reduction in those other services because a person was able to get those needs met and felt supported in that process, and were able to learn how to manage those symptoms. The cost of savings when it comes to those services, we were able to, and this is data from OCHN, is that, and for inpatient care is like $700 a day for like an average of 3-day stay. We saved them $178,000. For the CRU, $384,000. Crisis contact split between two different codes was 102, and so the average was $665,000 for a year and a half of savings. We are, like I said, we've seen over 400 individuals now, and we actually have a waiting list of people wanting to come in and utilize our services for support. A requirement for eligibility is that you have to be 18 years or older, you have to be a resident of Oakland County, and that there is no cost for services to the individual. The grant just did end in March, and so we're looking at sustainability, and OCHN has been a really huge support in keeping us up and open because they do see the benefit of our services. And we are also looking at being, because we are certified peer support specialists, that we are able to bill for our services through like one-on-one support and groups. But it doesn't necessarily cover all of the costs that we have, so we are looking at other ways of sustainability. Again, is that a person can call and just do an over phone interview if they meet the criteria, which is a very simple criteria to meet. As long as you're an Oakland County resident over 18 and you're willing to come and help work on yourself, we invite you to come. Again, as we have up to a 7-day stay, because we get a lot of individuals that want to stay more than that 5 days, but we don't want to necessarily say that we don't want it to be where they become dependent on our services, because you do get individuals that are struggling with being unhoused and stuff like that. So we help them look at housing options. We help them look at different ways to find, to be able to meet their needs. And we've been really successful at helping individuals find placement and stuff like that. And then the other thing is that we do a lot of different activities in our home. We do yoga, we do arts, and crafts. We have music. So people get to do a lot of different things. We go out into the community. For 4th of July, they went to the beach. They had a barbecue, and then went out for ice cream after. And, a lot of times we'll ask individuals like, what do you get out of, like while you were out today, what did you think about? Did you think about your mental illness or your emotional stress that you're experiencing right now? And a lot of them will say, no, I didn't think about that at all. And so finding things that you do in the community that give you joy, things that you can do that divert your attention from always focusing on the negative aspects in your life, can help change the way you feel. And so we try to get them involved in activities. One of the things I had a gentleman say one time is that he had never been in a crowd of people and was able to laugh out loud and feel normal. And it was just going to the movies and watching a funny movie, and he said that was the best time of his life. People come and will say is that, staying here was was good for me. I felt guilty because I was leaving my family behind, and I was doing something for myself, but I felt guilty about it, but they needed it. And then, we have individuals that will say they want to give up. they don't see any hope in their, or possibilities for their future, and so they just wanna give up. One of the things that we hope that when they are there, that we do give them hope. We show them some some possibilities for their future, show them things that they can do. We have individuals that are applying for jobs, getting jobs, and so it's like whatever that person's needs are in that moment, we support it. Like I said, it's been about 10 years that we've been trying to get this open, so we were thankful that we were able to open it, and then people can see the benefit of what this program brings. That is the house. It is 2,500 square feet. It has 4 bedrooms. We take up to 7 guests. We have 1 bedroom that is a single bedroom because of some of our guests may need, based on whether they may need that private space for themselves. So we do have that. And the one thing that we found that was really cool was that the community and the owner of the home supported our mission and our goals and our values. So we were proud of that. The house was, I'm not gonna go through all this, but the house needed some work on it, and so we were able to tear it apart. Never did that before, but we actually, peer support came together and we put that house back together. We're actually gonna send a video, Barbara has a video, and they're gonna send that to you so you can take a virtual tour of the home. And like I said, is that just wanted to get in the forefront of you guys' minds, let us know who we are, what we're doing in your community, my community, and so to be able to share that and hopefully come back in front of you again later on. So, thank you.
Thank you. Commissioner Powell?
So, I think this is all great, because we know it's a huge need, in the mental health space. So your program, is it a partner with OCHN, or is they over your program and you running it?
No, we are a private 501c3. And they had, when we had the grant, right, that they held the grant.
Oh, they was a fiduciary?
They're the fiduciary,
Okay,
yeah.
so that's why, okay.
Yeah.
And then, but they are one of the partners as far as a funding source for you?
So right now they are giving us some funding, yes.
Right, is it grant or is grant funding? Or-
I think it's coming from their general fund.
Oh, got it, okay.
And so one of the things, and like I said, is right now we're in the process of an application to become a provider of Oakland County services, to be able to bill for our services. And based on our ratio of individuals coming in, not everybody has Medicaid. And so, we don't want to turn anyone away that's an Oakland County resident, so we're looking at, it doesn't fully support what we do. We are connecting with right now the CCBHCs also, because a lot of individuals that we do get come from like Easter Seals, CNS, TTI, and so going through the CCBHCs would also be a potential funding source for us.
So that would be private insurance though, right? Through that way?
And it's not private insurance, no. It is, the CCBHC gets
What is CCBHC?
Oh.
Crisis Center Behavioral Health Clinic?
Yeah, it's where, like, let's say someone is receiving services, but they may not even be, they live in a certain area that they may not be eligible for that service. They can go through the CCBHC and get that. They could have private insurance and actually go through that and get those services through community mental health.
On a sliding scale fee?
It's on yes.
It's like a mental health urgent tier. Is that a fair way to say that?
No, it's philosophy, the CCBHC, the community. It'll come to me. But it's designed there is no wrong door for you to receive services. So if you come in for services, we're going to help you. Based on your needs, there may be a cost. Their first plan is to build the insurance, whether it's Medicaid or commercial insurance. Let's say you need home-based services or ACT services, which is somebody in your home and your Blue Cross Blue Shield does not pay for it. You will still have that service, but there will be a fee based on your income for that service. But there's no wrong door. So it's stating that we are going to help everybody. We want to provide services. So the CCBHCs in Oakland County throughout the state of Michigan are the core providers of OCHN right now.
And we're also working on a code for Medicaid to be able to have a billing code for adult MI respite services. Right now, it's for the caregiver, it's not for the individual, so we're looking at getting a code put into the Medicaid manual. We're kind of putting an addendum to it.
And what is your overall budget to run your program?
Last year, it was about $460,000, but again, as we provide the lodging, we provide food, we provide, the resources and like activity things, like the materials and stuff like that. Our workbooks that we work on, throughout the day, stuff like that, that has been our cost. So
Meaning when you say our cost, like y'all,
the
people
Hope
just,
365's cost, like we pay for, we are connecting with different food banks and stuff right now to look to partner with like Gleaners and stuff. I've been looking for partners in our community where the house is at to see if we could partner with them, because we would never be able to use all of the food that would be distributed, but I know the community could also use it. So we're looking at that to be able to, take some of the cost away for food and stuff like that. It just takes time.
yeah.
Yeah.
And you said your program been in place 2 years?
We started in March of 2022,
Okay, and then the house is located in what city?
Rochester Hills right now.
Okay.
Yep.
Thank you.
Commissioner
Thank you,
Gershenson?
Chairman.
So I thank you for coming. How did you happen to come to us? Who gave you that idea?
Well, I've been looking at different ways to be able to share about Hope 365, and like I know that a lot of individuals that are receiving our services know about us, but a lot of people in the community do not.
Okay, so I don't know anything about you. I'm very aware that we need more mental health services too. I feel there's a few things lacking in your presentation. The biggest one is your financial history, and so I would have a lot of questions about who you are that I don't see. I did go on your website. We don't have to do it now.
Actually
Right.
working on a new website right now, and we can actually, and that's one of the things that we're looking at too.
So do you have cards?
I do, I actually gave some to Penny.
Okay, so I would very much like to stay in touch and learn more about you, but just a heads up, there are lots of areas that should be filled out in a presentation like this.
Right.
Thank you.
Commissioner Gershenson, that one is probably on me. Deb and I used to work together for years ago. She's always had a dream of opening up a respite home before this came to reality. Last year, when commissioners were able to do a mental health video, I chose to do it about Hope 365. The house is gorgeous. The people who utilize the home have such a feeling of comfort when they're there. And it started out as it is a respite program. Let's say you are experiencing stress in your life right now and you need a break, whether it's 1 night, 2 nights, 3 nights. You could call Hope 365 and go actually stay there for a few days, which gives you a break from the stress. Meanwhile, you're learning coping skills also through the groups and talking to everybody there. It is an amazing program. It's a good mental health program.
So just hearing your take on it, Penny, is very helpful because I have so much confidence in your observations. So I'm just saying, I think that there should be something else in your presentation just for credibility. I too have started a grassroots project, Gilda's Club, so I know all that goes into starting one and I think this is amazing and would like to see you keep moving forward.
Commissioner Powell?
Why are these centers so conflictual and it's so hard for you to get one here? Because it just sounds like this is something we need to be investing in this mental health space.
Thank you.
And why is Michigan acting, or Oakland County or whatever, like why is it so hard to start one of these things?
One of the barriers that we came across is that not in my backyard, right? That, everybody says is that we don't have a mental health problem in our communities, and, everybody struggles with emotional wellness at points in their life, stress. Like some of us, we can go on vacation when we feel stressed out. We can go and take some time off and do something, and it doesn't affect our everyday day-to-day lives, right? But the people that we serve are individuals that don't have the luxury of saying, today I'm gonna take a break and I'm gonna go somewhere and just enjoy my life. When we first did our first walkthrough, someone made a comment about, well, this should be for people with private pay. And I said, this is exactly why it's for people that I'm serving in the community, because people don't have the option to be able to go somewhere and just be able to take care of themselves and, you know, and be poured into and be able to have someone that cares about them and listen. And, you know, we've had individuals that have come to the house and said, I can't stay here. And I'm like, why? They go, because it's too nice. I don't feel like I deserve this. You know, and so we'll say is that, you know, we are here, we are open, and we are, you know, we want you to, you know, we want to make sure that if you're here that you feel comfortable. You know, so it's, you know, sometimes it's, you know, I think it's just a really needed service. Like I said, is there's so many individuals and the stigma that's associated with mental illness, right? People don't want to self-identify. Because if I say that I need help, then there must be something wrong with me. Well, this is not necessarily associated with any of that. If one of the things we'll talk to individuals about is, are you connected to provider services? And if not, would you like to? You know, again, as we take individuals, any stage, I guess, of their recovery. You know, some people are just feeling overwhelmed because a life event happened and they need support, or maybe getting connected to a grief group because they've lost someone that was important to them and they don't know how to handle those emotions as they're coming along. Then we get individuals that are really struggling with their mental health and being locked in a hospital and getting put on different medications after medication may not be helpful for them. They just need someone, a safe space to be and feel normal.
So it
And be able
sound
to be
like,
their authentic self.
yeah, it sound like a money thing. It's that bad, it's us, it's the politics, like that's how I feel.
I would also like to say that some of the difficulty in finding a home is related to the city ordinances and the zonings.
Yep.
Which was a barrier, because numerous cities were reviewed first.
Yes.
Rochester Hills was accepting. We can talk later
Yeah,
about the
no,
cities that were
and we
not.
do, I have two, these are professionals in this space, so I am gonna have a talk with them because I just think that this is something that from a vision, down the line, more of these are about to start coming up, but it's a good thing behind it as far as helping yourself, you know, in the mental state, so thank you.
Yeah, thank you.
Yep, Commissioner Cavell?
I'm sorry for being late, so forgive me if you mentioned this, but I was curious, and Penny kind of mentioned this, what made you want to do this? It sounds like a second act thing.
Well, so because I have my own lived experience, I have struggled for years. It was with addiction and my mental health, and was able to get into recovery 24 years ago. Received mental health services myself to deal with trauma from being trafficked, and realized that there was not a lot of support out there for individuals when they needed that help. And so started working in the mental health field. Realized that there was a need for others that, like I said, is that the need was that there was either you're doing well or you're in crisis. There was nothing in between. And people don't need to get into crisis to get help. They can, you know, stop it at they can recognize it, get that support that they need, look at new ways to cope with that, and then still move on with their life. And so that was one of the reasons. And then also I had children that were in the receiving services. So I'm passionate about it. Yeah.
Thank you. Commissioner Nelson?
Thank you, Madam Chair. First and foremost, I commend the work that you're doing and working towards doing. As a behavioral health provider myself, respite is such a significant aspect in not only the mental health field, but with our seniors and individuals who have disabilities. I know I would love to further this conversation with this body because I do know that back in 2012, 2013, there were significant cuts in respite from our Oakland County Community Mental Health from 10 to 20%. And it eliminated a lot of already existing respite care facilities throughout Oakland County. So I would love to engage in a conversation in kind of just revisiting those components because it is so important, and there are life-changing measures that take place. And just looking at the statistics that you provided in your PowerPoint, rather than hospitalizations, there are other options to be more proactive
Yes.
than reactive. And I look forward to seeing how Hope 360 grows and progresses forward, and would love to have further conversations in regards to looking at some of the things that maybe we do have control, authority over, and engaging in those conversations with stakeholders to look at how we can move forward with a different lens.
All right,
Thank you. We do need more mental health respite and peer support.
Yeah.
And how we can help this program and perhaps other programs or homes in other cities is a good way to start. So I want everybody to keep that in mind.
Yeah, I mean, like I said, we're getting a waiting list now. We have, like, last week, we had like 6 people on the waiting list waiting for a bed, and, you know, they had to wait multiple days before they could get that help.
Thank you. Any other questions or comments? Thank you very much.
All right, thank you.
I do want to say the CCBHC stands for Certified Community Behavioral Health Clinic.
Took me forever just to get the acronym.
Yes, yes, yes. So, all right, so I need a motion and a second to receive and file this report. I have a motion by
Motion.
Commissioner Powell and support from Commissioner Joliet. Thank you. All in favor, say aye.
Aye.
Opposed? All right. Presentation is received and filed. Thank you.
Thank you so much for having me.
Now we move on to our circuit court recommendation. There is one. It's an acceptance from the Michigan Department of Health and Human Services for the fiscal year 2024 Child Parent Legal Representation Grant. I have a motion by Commissioner Nelson, support from Commissioner Cavell. And, we have Chris here to talk about this.
And I have Ramel Pennick with me. Ramel, you may remember from our last application when we came for this grant. Ramel will be overseeing a good portion of the reporting for this grant and is working right now diligently on next year's, because we're starting this grant pretty late in FY24. We will be back probably in just a couple weeks for FY25 with our application for approval. Did anyone have questions about this grant? That we are hoping to provide additional services to residents. In case you don't recall what it was for, it's child parent legal representation. We're gonna provide ancillary services to help with barriers to permanency or things that are blocking reunification. We are also hoping to provide additional training on the front of juvenile justice reform for our attorneys. We're increasing the attorney fees for the juvenile attorneys so that we can attract and retain qualified counsel. And we'll be offering a mentoring program, again, to help attract and retain qualified counsel.
Commissioner Cavell?
So this grant is, if I read it right, for $175,000?
Yeah, it'll pay 25%, so it's kind of up to that amount.
Mhm.
What we get back is really based on what we spend. So they gave us some estimates, DHHS did, and we looked at our caseload and we came up with estimates. Of course, it was a little earlier in the year. So I don't know that we'll reach those targets for expenditures, but that is a reimbursement grant of up to 25% of what we spend. So they will reimburse us up to the $175 this year.
Is there then, okay, that makes sense, because when I read this before, I thought it was different. So then does that mean if we provide more services or use like the child care fund to do more things, they can then reimburse higher over time?
We can't combine this with child care fund. This is totally separate
Yeah.
from our child care fund.
Right.
So they're both provided by DHHS, but that's about where the similarity is. Our target group, that really the people we're looking to serve are families with a child who have a neglect issue and the child has been removed from the home, at least at some point during that time. Our child care fund covers primarily our delinquencies and some of the neglects.
So that, kind of what I'm trying to get to is, if there was more money in the 75%, right? If it went from 100,
Yes, if the more money we spend, the
$225.
more we will get back.
Right.
And
you said maybe you won't reach the 175.
Only because we're starting so late in the year. You know,
Okay.
we're pretty far into the year, because this is based on the fiscal year. So we only have until the end of September to spend those funds. So will we spend that much in 3 months? I don't know, especially with just getting the program off the ground. We have to kind of get the word out. We've been reaching out to attorneys and out to some of the service providers to make sure they're aware that we can offer this and that it's available to them now. We'll be back next year with a little bit higher estimate and I think a little bit more likelihood that we'll reach that target next year. But our target for this year is to recoup $175,000.
Gotcha. Thank you.
Commissioner Powell?
What is the marketing strategy with the attorneys with it? How are you informing them, like,
Well, we reached out to all of our court-appointed attorneys.
court appointed? Okay.
Yeah, because this is really for the court-appointed.
Got it, that's all, I missed that part.
Okay.
I'm thinking of, attorneys that may practice in this space, I didn't hear the court appointed,
But
so
the-
you're fine.
Court-appointeds may bring in other specialists. So for instance, if the barrier is immigration or, or something like that, they may need to bring in another attorney, kind of tag someone in whose specialty that is.
Okay.
So it may actually broaden the number of attorneys that provide services to our families.
Commissioner Gershenson?
So maybe I missed, why is it so late this year? Is that just when you received it?
In the past, this grant has only been available for a few years. And in the past, it was not applied for when it first came out. The challenges with this grant in tracking it are numerous. So it is going to mean an awful lot of hands-on work for our staff in trying to track it. We feel like we have the right resources in place now to take that attempt. And it was one of the first things that Ramel took on to try and get us that funding.
I really appreciate that, because what a shame when that money's available, but it takes so much infrastructure to even apply for it. It's ridiculous. So you'll be late on it this year, but then the cycles that continue.
Yes, we
Yeah.
hope to have it for all of FY25 and beyond.
And
as
so
long as they
what does
provide
it mean here that the total amount of the agreement is 700,000?
So in our budget, some of this is services we already provide now, right? We already pay for court-appointed attorneys. And so we have some favorability in that line item. We have been able to leverage that favorability to receive some reimbursement by providing these additional services using that favorability.
Okay, thank you.
Any other questions or comments? All right, we are actually doing a roll call or oh, never mind, we're gonna do a prompt to vote. Thank you.
Thank you.
Powell,
Yes.
Taylor,
Yes.
Nelson,
Yes.
Loops.
Yes,
You have 8 yeas and 0 nays.
all right, motion carries. Thank you for
Thank you very
waiting
much.
with us.
We'll see you in a couple weeks.
All right, next item is from the prosecutor's office recommendation. It's an application to the Michigan Department of Health and Human Services for the fiscal year 2025 victim rights. I have a motion by Commissioner Nelson, support from Commissioner Taylor. And we have Mary Larkin here to speak to this item.
Good morning, Commissioners. I am Mary Larkin. I'm the Victim Services Leader in the Prosecutor's Office's Victim Services section. And this is the 33rd year of grant acceptance for this Crime Victim Rights Grant. Our allocation this year is $796,000, and that's through the Michigan Department of Health and Human Services. It enables the Prosecutor's Office to comply with mandates set forth in the Crime Victim Rights Act and the Michigan Constitution that require us to provide victims of crime with notice about the events in their court case as it's going through the court system. And it also requires and enables us to provide court accompaniment. That's where we actually have victim advocates that go to the courtroom and sit with the victim explaining what's happening during a trial, during a hearing. It makes an incredible difference for the victims. We are blessed to be able to do that court accompaniment with the help of our 3 canine advocates These are 3 specially trained dogs that came to us through the Leader Dogs for the Blind. They were career change dogs. They didn't make it in the Leader Dog for the Blind program, but they are phenomenal assets for our program. So they accompany advocates when children testify in court. Oftentimes it's against an offender that they know. Oftentimes it's sexual abuse by a family member or a trusted person in their life. And these dogs sit at the feet of the child at the witness stand and provide unbelievable comfort and reassurance, allows the child to be able to give meaningful testimony. So we are very thankful for that, and the grant does provide funding to take care of those 3 canine advocates. So we are asking for approval of this grant application again. I'm happy to answer any questions. Just very, very briefly, it provides 2 aspects for us. It enables us to notify victims what's going on in their case. We mail a notice, and we're now moving into the ability to email victims with what's happening in their court case. And secondly, the court accompaniment feature. We have seen a tremendous increase in our volume. In the last 3 years, we have tripled the number of cases that victim advocates go to court with the victim on. So we're really pleased about that. And when the time is right, through the Michigan Department of Health and Human Services, after the beginning of this next fiscal year, we intend to request additional funding through them. We would love to be able to expand this program and add at least 1 or possibly 2 more victim advocates to allow us to reach many, many more victims that we are not able to right now. So I'm happy to answer any questions. I appreciate your support, and thank you very much.
Thank you. Any other questions or comments regarding this? All right, would you prompt the vote? Yes.
Nelson,
Yes.
Gershenson,
Yes.
Cabal,
Yes.
Taylor.
Yes.
You have 8 yeas, 0 nays.
All right, motion carries. Thank you, Mary.
Thank
That was
Thank you very
very
much.
well explained.
Thank you.
All right,
Appreciate everybody's support.
thank you. All right, next 3 items are from the sheriff's office. The first is general fund contingency for special signage at the Dream Cruise. The second is an amendment to the law enforcement agreement with Springfield Township. And the last item is accepting the Office of National Drug Control Policy for the 2024 high-intensity drug trafficking areas. Who would like to make a motion? We have a motion by Commissioner Nelson and support from Commissioner Joliet. And we have our Under Sheriff and Guy here to talk to these items.
Good afternoon. The first one is our annual request. So the sheriff's office is the one required to obtain the traffic control order for the Dream Cruise. So we apply through the Michigan Department of Transportation. However, the road commission by law has to place the signs. So we're here each year asking for an appropriation to pay the road commission to put up the signs and take down the signs after the Dream Cruise. So their estimate they provided to us this year is $14,775. Typically, it comes in less than that, and then they bill us the actual charges, but that's the estimate they've provided.
Thank you.
The next item is the Charter Township of Springfield has requested to add an additional patrol investigator position, which will serve as a school resource officer for the Clarkston schools, beginning August 19th. And the final item is our annual acceptance for the HIDA grant. This year it's $132,300. There's no required match for this. This pays $120,000 in overtime for the narcotics enforcement team. There's 10 officers within the sheriff's office and then 10 for outside agencies, so it's roughly $6,000 an officer. And then the remaining $12,300 is for communications.
Thank you. And Commissioner Powell?
What is considered high-intensity drug trafficking areas? Or do we have and if you can't, if it's too lengthy for now, I would like to just see something that kind of shows us what is considered high drug trafficking areas.
I will send you a map.
Thank you.
Basically, the short version, it's kind of along I-75.
Got it, okay.
Commissioner Bell?
I saw in the Springfield law enforcement SRO thing that Clarkston already has 4 SROs. Are those county deputies? And if so, how long have they been there? Because I don't remember us doing anything about approving those.
Yeah, they've been in there, so they're in the Independence Township. This one's through Springfield, but the other ones are in the Independence Township agreement and have been in there for years, so.
Okay. Are they part of the Safer Communities Fund?
Not yet, that will be going forward when we do the new rates starting in January.
Anything else? Will you prompt the vote, please?
Powell,
Yes.
Nelson,
Yes.
Gershenson,
Yes.
Taylor,
Yes.
Lutz.
Yes.
You have 8 yeas and 0 nays.
All right.
Thank you for your
Items
support.
are approved, thank you. I think we now have a low energy meeting.
We do. Our stamina
More
is
items, yes. 2 more items from the Health and Human Services. The first is accepting the Michigan Department of Environmental, Great Lakes, and Energy Water Resource Division for the 2024 Inland Lake Beach Monitoring Program grant. And the last item is the 2024 Annual Action Plan grant application to the U.S. Department of Housing and Urban Development for the Office of Community Planning and Development Formula Programs Grant Funding. I have a motion by Commissioner Taylor, support from Commissioner Joliet. And we have Stacy Sledge here to talk to these items. Welcome. Oh, you're on mute.
Thank you. I'm Stacy Sledge. I also have with me Tony Droughts, the public administrator for environmental health. This is our acceptance for the EAGLE grant in the amount of $44,420. This grant goes from June 1st of 2024 through December 31st of 2025. And there is no local match required. This funding supports sampling and testing and monitoring of the inland lake beaches, which is conducted by the Health Division, Environmental Health and Laboratory staff, as well as summer sanitarians and laboratory students. This funding also supports training the student sanitarians on beach survey methods and sampling techniques. And I have Tony here. Do you have any detailed questions about the program?
Thank you. Commissioner Gershenson?
So is this the amount that funds all the inspectors that monitor the lakes the health department does? The health department oversees? So there's no additional funding to bring on more inspectors or to be able to monitor more lakes. This is the full funding, it's a grant, it's not out of the general fund or?
The amount is a partial request, and these are 2-year grants, and we apply for these each year. So these would cover the funding for the students, is my understanding. The interns that we have 6 interns that come in each summer, and they're the ones that conduct the analysis.
So are there health department employees, sanitation or employees that also go out and check the condition of the lakes, or it's strictly this internship program?
We have people that train. We've got lab personnel, obviously, that analyze the water samples. And depending if the samples come back where there would be a beach closure, the students are only here for a short period of time. They go back in early August, and we will have our full-time staff go out and continue to sample until the beaches, typically it's around October, where we don't feel that the active beaches would be used. And if we did have a closure that season, we would continue to sample.
Okay, so I might not have been clear. So we do have full-time staff that is involved in this until October. once the student,
Eventually.
I see, okay, thank
Yes.
you, thank you.
Commissioner Joliet?
Quick question, for the lakes that aren't able to be sampled, because there's so many in Oakland County, can residents from the lakes bring in water samples and have the county run them or look at them?
Yeah, we do have testing for water samples, for surface water samples that would be available if somebody wanted to bring in a sample.
So where would they come to get that? I'm assuming that you'd give them,
They could either go to our lab, or they would come to our counter here in the Pontiac office, and they could give you water bottles and instructions on what would be necessary to complete that type of sampling.
okay, perfect, thank you.
Any other comments or questions? Okay, so two separate departments, we need to vote on this first one. Do?
Yeah, this
We
is
can
one
do it together?
department, yeah.
Okay.
So this is what- you can do whatever, but yeah, there are one.
All right, thank you. So hang on just a minute. So our next item, our presenter is Khadija. Oh, we have,
Good afternoon.
thank you. Good
Hello, everybody.
afternoon.
So I am coming before you all today because we are ready to submit our program year 2024 annual action plan to HUD. We have a total of $9,477,415 that we would like to apply for to provide our community development block grant program, our home investment partnership program, and our emergency solutions grant. With this funding, 6.2 million is directly coming from HUD. A portion of the funding would be based on what we estimate for program income and revolving loan fund, which is the funds that come back through our home repair program when we go out and we have different consumers in Oakland County who are applying and taking out a loan for home repairs. With our different programs, and I'll kind of give the breakdown here, we have 4.5 million that would be in total for the home program. We're looking for a grant match of $516,149 for our home program because 25% of our home program does require a match under HUD. With our community development block grant program, there is no HUD required match. And so the total allocation for that program would be I think I need my glasses on. For CDBG would be $3.6,405,249, and we have a $1 million estimate for revolving loan fund coming in for that. And then for our emergency solutions grant, there is no HUD required match that we need to take out of county funds, but there is a 100% match for volunteer services and donations that are required. And those are met through our different service agencies that we contract with for that program. And the allocation for ESG is $322,021. And so this is the main source of our funding that we request each year from HUD. I would like to state that we have ran the plan through the Citizens Advisory Council. We did receive unanimous support for the plan this year. And this plan also would include the application to continue with our 24 special revenue positions. There's no change from previous years in terms of our positions. You have that provided in your Schedule B, so it is the same as in previous years. And we are just requesting to move forward with that application to HUD so that we can continue the great work that the team has been doing in these programs. I'll pause there for questions.
Thank you. Commissioner Powell?
With our home improvement repair program, this is a future type question. Are we looking to kind of review our program? Because I think with a lot of changes and inflate, like all types of stuff and people income, I don't know if our scale is has adjusted to help people. Because a lot of people are not qualifying for this program, and we know this housing space is a major issue with us, and I just think that because of all the changes, we need to kind of maybe revisit that. I don't know. I don't know if this is a governmental structure, then it is what it is. It's something we can't adjust or review. So I was just calling, I mean, I just want to ask your opinion on that, like how the team looked at maybe revisiting that.
That's a great question. So it is, so we are confined to the federal guidelines that are released usually each May of the year. And so the federal guidelines are very specific in terms of household size and what the threshold for income is regarding how we use those funds. And so we have to adhere to that. And so, you know, we're beholden basically to that, but we have tried to do some creative things in-house this year to support residents in a different way. So one of the things that we have done is that we moved the mobile home repair program in-house so that our staff and team that works under the home repair program can start working with communities who have had a pretty desperate need for support around their manufactured and mobile homes. And so that's kind of one way that we've added some additional supports and services. Once again, we still have to adhere to the guidelines that are set each year, you know, through HUD. So there's some, you know, confinement there in terms of how we do things, but we do try and be creative, Commissioner Powell, where we can to make sure that we're serving as many people as possible.
Has it ever been thought for us as a county to kind of create our own in the housing space? Or eventually maybe, or is it a discussion that can be had?
I think it's definitely a discussion that could be had, you know, so it would just be, you would have to find a funding source that would allow some flexibility around those income guidelines and probably a different grant source. Because a lot of them kind of adhere to what HUD says.
Got it.
So it's certainly possible. It would just be a matter of dollars, I guess.
Okay, and then my last question is, I had requested that our team, housing team, get with the city of Pontiac in regards to some stuff. Has that happened? I actually sent the follow-up and I didn't see a meeting scheduled yet with y'all.
Yes, I did see your email this morning. So I think our administrative support team's still working on coordinating everybody for that meeting.
Got it.
So I know that it is in the works. I have not seen anything come across for the final date.
I just wanted to know it's in the works. Thank you.
Absolutely. I know it's on the docket.
Thank you, Chair.
Sure. Any other comments or questions? Commissioner Gershenson?
I have a question. We have a contract with Oakland Livingston Human Service Agency for chore programs. Is this different? These CDBG funds are different?
Correct.
than
They're different.
what we're,
Yeah.
okay, thank you.
Yeah. Sorry.
No, that's okay, if you wanted to expand, or you're good.
Yes, I was just gonna say that, yes, the chore program is utilizing those ARPA dollars and this is the HUD funding application.
Okay.
But long term.
Any other questions or comments? All right, would you prompt the vote, please?
Oh.
Like local cities using their CDBG.
Correct. Right.
Okay,
Thank
Powell,
Yes.
Nelson,
Yes.
Gershenson,
Yes.
Val,
Yes.
Taylor.
Yes.
We have 8 yeas, 0 nays.
Motion carries. Thank you, everybody, for staying with us this morning and this afternoon. Your motions are approved.
Thank you.
Thank you. All right, our last item of business is public comment. Is there anyone from the public wishing to comment? Seeing none, I will close public comment and adjourn this meeting at 12:20.
Other business?
Oh, I'm sorry. We have something for other business. Thank you,
Okay, good.
Commissioner Gershenson.
A couple things. Over the weekend, there was an upsetting article in the Detroit Free Press saying that parents that are in the foster care system are not getting any of the mental health services they require when they adopt a foster care child that might be coming with a myriad of problems. So I'm wondering about that. And I'm wondering, we have appointees to the DHS, is it the DHS? And I want them to come talk to us about it. I wanna know, is there anything we can do? There may not be anything we can do, it could be federal and state funding, but
We can have the representatives come
We
come
don't
for a
hear from
presentation.
them.
But I would say from my personal professional experience is that the adopted children or adoptive parents have the opportunity to continue with a Medicaid status, even if they have Blue Cross or Aetna or whatever. That Medicaid is out of Lansing, and that would continue to pay for therapy and additional services.
Okay, so I would just like to get an update on where we are in our county with that issue. Also, Christine Burke was here with the mental health navigators that they employ, and they brought their
They brought Trudina, who is the
Right.
manager of our OCHN Access Department.
Right, and so they didn't get a chance to present. I'd like to ask them, and rather than be a communications, I'd like to hear about what they're doing, so maybe we could put them on the next agenda.
We did have an update by Dana maybe a month ago, but we can do it again.
I'd like to hear directly from the navigators. And then there was quite a bit of publicity coming from the sheriff after Rochester that he doesn't have enough mental health advocates. I'm not aware of him requesting that. This was news to me. I'd like to pursue it to find out what we're talking about.
There were news articles.
Right, but I don't remember him, I don't remember a request.
He did not say personally or specifically to any county employee. He reported that in a public media.
Right, but I have gotten phone calls from people saying, why aren't you funding the sheriff's department mental health, why aren't you filling their needs? So I said, I don't remember him ever coming and asking for it.
And I think publicly he did report there was one person, but
Yes,
they
he did.
needed
It was in the
more.
article. It's a serious
Yeah,
matter.
yeah, first Commissioner Powell, followed by Commissioner
So
Cavell.
was Sheriff referencing our co-responders to go out? Is that who he referencing?
No, an
No, I don't
internal
think so.
person to help the sheriffs with the trauma they experience from responding to emergency situations.
Oh, yeah, I don't recall him ever asking that. And some of us got relationships with him, and if he would have said that, we would have visited that conversation.
Well,
and he
yeah, I
didn't.
mean, if it's a discussion that needs to be had, then we should have it.
So is this something we can check, have staff check into with them to see?
Yep. Commissioner Cavell, followed by Commissioner Nelson.
I just want to remind it, so, right, I've never heard him ask for that. And also, as county employees, they have excellent healthcare benefits where they can get.
An EAP.
They can do EAP, and they also,
EAP is
Employee
Employee
Assistance
Assistance.
Program, so they already get that as a benefit of being employees. And also, just in case anyone else isn't doing it, I go to therapy every week and my copay is $14. And they have crisis therapists, they have therapists for people in trauma that have trauma backgrounds, they have people, so there's all sorts of therapists, especially in Oakland County or within driving distance from wherever a sheriff's deputy would live. So there already
Through our
are,
health insurance.
yes, and it's $14 for me for my copay.
Oh,
So I don't know what it is for them because they also have they have a 14-6 retirement, so they might have other nice benefits that we don't get even. So just
that's a
to say that there's already that out
Good to be
there.
informed on what's, on the.
So there's already that stuff out there that they all have access to as being a county employee. And then second, they do have one support specialist person, but that's for 1,500 employees. So I just want to say, since we're talking about it, to me, and maybe I'm off base here, it feels disingenuous to request in public without conferring with us or the executive one more maybe. So if he's trying to solve that as social workers here, how many people do you have on your caseload and can you handle? So if that one person is working for 1,500 people, I think if he was genuine with that request, it would have been, give me 20 of those people. But to him bring it up in a news conference after a tragedy feels disrespectful, I think, to all the people that work in mental health or need mental health.
I think it's worth looking into.
Definitely.
Commissioner Powell?
Yes, I was gonna say the same thing because that ain't right. That's not right. That's
They
not
already
right,
have it, though.
especially if we offer, cause he ain't say nothing about all the benefits they got.
Yeah.
So how many of the 1,500 employees are utilizing this stuff?
Yeah.
Which that's private information, but my thing is, don't put it out there like we just ain't doing nothing.
That's
for our
35% of everything we pay for too, because that's the benefits, you know?
workers. Okay, thank you, I'm sorry.
Commissioner Erickson Gall?
I hate when you do that.
So, fine, it's fine, I know.
Oh, I'm sorry.
Go ahead.
Oh,
Go ahead.
Yeah, go Chris.
No, go ahead, Ann. Go ahead.
I was just gonna say, I was actually watching that news conference live, and it kind of threw me, cause I'm, granted, I'm new to this process and I didn't sit through budget last year, so I don't remember what was discussed about this. And he talked about specifically using his own existing sheriff department funds to hire a special company to come in and provide crisis mental health services for the deputies. And then, kind of as an aside, there was this discussion of, the Board of Commissioners should give me funding for this, and I'm thinking, have we not? And I actually got asked by a staff writer for C&G newspapers, kind of threw that question at me, and I'm like, there's a process for this. I would absolutely consider, a request, if he needs to make the request, and it needs to go through the process. That's how this works.
OCHM provides emergency crisis staff if requested.
Yeah.
Right.
Keep that
So-
in mind.
Thank you, Chair.
So I was a little taken aback by that comment at the news conference. It just, like you said, it didn't seem, it didn't seem like it was, the suggestion was that that this had been asked for and not provided, as opposed to, I'm going to ask for this.
Right,
Say
well,
some
those are the
crazy stuff in
comments
front
I
of
got.
cameras, huh?
Right.
Commissioner Nelson?
So kind of along the same lines, I don't know if any other commissioners have received any communication, but very similar messaging with the mental health physician assistants. I've gotten some emails about helicopters, and again, kind of the same thing. I'm being contacted by people who are demanding that I consider the purchasing of 2 new helicopters. Again, kind of in the same position of, well, if that's the case, we haven't received any communication from the sheriff's department in regards to 2 brand new helicopters. So it would be appreciated if we could get some dialogue going with the sheriff's department in regards to these things, because I get it, it's election time, but it's also very disrespectful, and quite frankly, it's not truthful. And so it would be great to settle the air and really talk about what's come before us from the sheriff's department in regards to some of these things that we're talking about today.
Well, I think from our sheriff's department, our under sheriff and Guy up here are here each meeting, and I believe that they have, that they're honest and true.
Sure.
So it's.
Right, I just don't think it's come up.
Position.
I asked Gaia if she was staying, because I'm gonna call her and follow up, because I'm not getting any letters about helicopters, so there's definitely
Well, they turned out to be your
targeted-
constituents after looking them up. They're yours.
They're mine?
They
They're
are.
writing you?
There's 3 of them.
Commissioner Powell?
I haven't heard
So I was
anything.
gonna say, with the helicopter, I have heard him talk about this helicopter situation and the urgency of what he has needed in that space. And from my understanding, the only thing that was stated is that conversations of that has been held with leadership, meaning just the chairman. That was it. And they're in dialogue. So I just wanted to put that out there of what I've heard, because he's talked about these helicopters, and I know I've conversated with him or staff, or I've heard this conversation though, at least in the last year or two, because we had found out, and also the holiday extravaganza was trying to see if we can offer like a free ride as a
Auction.
Yes,
Yeah.
thank you. And that's when we found out, and I was like, oh, I forgot we only got 1 helicopter. So I do know that we do need some to eventually look in that space of what is going on with our helicopters, get a report, but I agree. we have not gotten a personal request for him to say, hey, let's talk about these helicopters.
Maybe it'll come in the budget.
That's all.
Well, and a lot of the chatter with the helicopters too, in all fairness, came after the town halls that he had had.
Yes.
Yes, so
Strange how this stuff
it
works.
is, it's
So we're
very
off the
fun
corporate
how it
Commissioner
all is
Cabal?
coming around,
Thank you,
but
Chair. I
it
think
would be
just,
good to have clarification.
I think Marcia kind of said it, or Commissioner Gershenson also said it, that I think if he wanted it, it would be in his budget. And the executive and the CFO have talked with the sheriff's people. They were their first budget meeting. So if we see it in Finance Committee for the budget, then that will be the executive recommendation. One thing just to note, Cook County, I'm part of this program for criminal justice reform that's like a MacArthur Fellowship. Cook County, one of my colleagues, that's where Chicago is, has 0 helicopters, and that's where Chicago is, just as an aside.
Okay, so we're going to clarify about the animal adoptions, clarify the sheriff's statements. And we do have a mental health ad hoc committee that worked with ARPA and CARES Act money. It's not active anymore?
Yes.
Oh,
It's not
okay.
existing anymore, we would
So-
have to call them.
Then how do we go about discussing respite homes, or how we could manage additional respite homes, or how we can support the present respite home?
OCHN, I think OCHN, it's all about funding. And it comes from OCHN, so maybe it's just a matter of reaching out and asking, hey, what are we doing presently in
Well,
regards to respite
OCHN
services?
referred her to us.
I don't think so, OCHN knew that she's coming.
Yes, well, that's what you told me.
So OCHN provides the funding, but like community living services, MORG, the ARC of Oakland County, they would be the ones accepting the funds.
Okay.
So I'd be interested, like is there a line item of respite care services in Oakland County in the current OCHN budget?
Okay. Commissioner Gershenson, followed by Commissioner Cabal.
Well, but I think this is such a hot topic right now. I
Yeah.
mean, mental health services. During COVID, it really came to the top. I mean, maybe we should look into having an ad hoc committee that tries to get a handle on what we have, what we need. Maybe it's a good discussion we should have with the chair, that this is an area that I'm not sure after the ARPA funds that we're really looking at. Cause for ARPA funds, it was a big focus of all of our grants, but now maybe
Okay.
we need to continue that discussion.
I like that. Thank you. Commissioner Cabal?
I was just gonna say that
All right.
All right, any other business to be discussed? Okay, then this meeting is adjourned at 12:41. Thank you,
Thanks, everybody.
hey, we got our second win, everybody.